Hi everyone, this is Dr. Funke Afolabi-Brown. So today we're going to be talking about a really important but sometimes relatively sensitive topic, and that is bedwetting. And the reason why I'm bringing this up is I have heard from a lot of you who have kids that are 4, 5, 12, 8, that are still bedwetting, and it becomes a source of concern for the family. And sometimes it becomes a source of shame, especially with a child who's bedwetting. So today we're going to be talking about what is bedwetting, when is it a problem, what are the causes of bedwetting, or what we call enuresis, especially nocturnal enuresis, and what can we do about it. And so, for those who don't know me, I am Dr. Funke Afolabi-Brown, and I'm the founder of Restful Sleep MD and the Restful Sleep Place. And our mission really is to empower families, including children and their parents, to sleep better so they can thrive and reach their fullest potential. And that right there is what we do all day, every day. So if you have not subscribed to this channel, I would love it if you do so right now, so that when there's new content, you, my friend, will be the first to know. So let's start with the definition. So bedwetting, or what we call nocturnal enuresis, it is an involuntary condition. So what do I mean by involuntary? Meaning like your child doesn't go to bed intending to wet themselves, right? And it occurs when a child, wets themselves during sleep. And it's not only children, it occurs in adults as well. So this is something that is relatively common in children. Most people tend to outgrow it, but sometimes it can linger even onto adulthood. And there are two different forms. There's what we call primary nocturnal enuresis, meaning that your child has never been dry before. So I'm talking about a child who is maybe 5, 6, 7. They've never had any prolonged dry spell. So that's what we call primary enuresis. The other one is what we call secondary enuresis. And that really has to do with the child who maybe they have been dry before, and maybe dry for about 6 months. We usually will go with about 6 months, and then they now start bedwetting again. And usually when I see the secondary enuresis, that's when I'm actually a little bit more concerned, because something has changed. So what are the causes of enuresis or bedwetting? So different things. The first I would say is it might be the bladder size. It might be that your child's bladder is a little bit smaller, and so it doesn't have as much of a capacity to hold urine throughout the night, and that makes them more prone to wetting themselves. Another reason why you might see this is if you have decreased hormone levels. There's a hormone called antidiuretic hormone, which everybody produces. It's produced by the brain, and it helps to concentrate urine. Now, in some conditions, you might have a lower level of antidiuretic hormone, or ADH. And in that situation, your child may have a hard time concentrating their urine. And if they have a hard time concentrating their urine, they're going to produce large volumes of urine. And so because of that, they might wet themselves. Another reason why we see this really actually pretty commonly is in genetics. So it runs in families. So if there's a family history of bedwetting where the parent is like, well, I wet my bed till I was 10 or whatever, it might be something that you see. So there is a genetic tendency. In situations where a child is very stressed or very anxious or going through a very stressful phase of life, they might actually tend to have almost a little bit more irritable bladder, and so they may be more prone to bedwetting. Next, I will talk about is sleep disorders. And it turns out that that's not the most common cause of bedwetting, which is why I put it as, I guess I'm number 5 now or so. And so conditions like sleep apnea, conditions like, periodic limb movement, where their sleep is getting fragmented, may put your child at risk for bedwetting. So that's always something we want to address, because sleep apnea is a serious condition. Not only are they bedwetting, they're pausing in breathing during sleep. It is not good for their brain. It is not good for their immune system. It's not good for their metabolism. It's not good for learning. We definitely want to address that. Okay, so the next reason that we might see where a child is more prone to bedwetting, maybe if there's an anatomical problem. So if their urinary tract, right, is abnormal, and that might be something congenital, it might be because there's a stone, it might be a mass. There are quite a number of reasons. And so when we have a situation, again, where your child is persistently bedwetting, you may want to have that checked out, because if there's something that's obstructing or something that's abnormally formed, we want to address that, because it might potentially be a treatable situation. So next, this is actually pretty common actually, is constipation. It is quite common. So this is when children either hold on to their stool or they just have a hard time pooping regularly. And so what happens when they're backed up, guess what? It creates almost like a mass effect, and it's going to squish that bladder. It's going to make it hard for them to, hold on to urine for long, right? So they're more likely to wet themselves. And then another common reason that we see is things like urinary tract infection. So your child might have a UTI where there's an infection either in the bladder. And so because of that, they may need to pee frequently. We call that urgency. So they have this urge to pee and they're peeing very frequently. And so they may have those sensations at night and they're not aware of it. And so they may also pee at night. So we've talked about a whole host of reasons. So I'm a sleep doctor. Of course, I want to make sure that you're not missing something serious like sleep apnea, but there are so many other practical reasons that you can speak with your child's pediatrician about to figure out what is going on and how we can fix it. So the next thing we're going to be jumping on is, what do we do about that? So now you have a child. It is, been going on for a while. You've done some practical strategies. What are we going to do? So let's talk about some of those practical strategies, and then situations where you may want to start to look and seek expert help. So the first thing I'm going to talk about is around fluids. And I'm going to tell you, because the most common thing you hear out there is, yes, restrict fluids, don't give them any fluids. You don't want your child to be too dehydrated, because actually when they're dehydrated, they're more likely to wet themselves at night. It's a very interesting phenomenon. You don't want urine that's too concentrated. So what I recommend on the other hand is actually be very generous with fluids. Make sure your children are not getting home or are not dehydrated in school, because if they're dehydrated in school, they're going to try to make up between the time they get home from school and bedtime. So they're going to be drinking. And so now they're overhydrated, and then they're more likely to have accidents. So have them drinking. In fact, you may need to talk to your child's teacher to say, I need to make sure he's taking enough water, she's taking enough water. And then about an hour or two before bed, you now want to start to limit those fluid intake, right? And that's perfect. That works well because they are well hydrated during the day, right? So they're not as likely to wet themselves. And then the other thing you want to be careful about around fluids is not just water. You really want to avoid caffeine. Caffeine is something that can make kids, it actually serves as a diuretic. And so if your child is drinking soda, iced tea, coffee, whatever it is, that might actually be what's making them pee a lot at night. So that's something I would cut back or just eliminate completely. Sugary drinks also have a similar role. So if they're drinking a lot of juices, that might contribute to bedwetting. That's the first basic thing I think you definitely need to be aware of. And then the other thing I would say is regular bathroom visits. So almost like training their bladder to learn the sensation of, urine, and learn the sensation of voiding, right? So you want them to use the bathroom frequently. At bedtime, you might want them to, we call it double voiding. So you're done with the routine. They use the bathroom during the routine. They're in bed. You've finished the routine. You may just have them come back, use the bathroom one more time, and then they can go to bed. So that's really something that would help. So try to empty the bladder as much as possible. And in some situations, if you are motivated, you might actually gently wake them up sometime in the middle of the night to pee one more time, really, because again, you're trying to teach them to not hold on to urine for way too long. And then we now start to get to things like bedwetting alarms. And this is quite common and quite effective as well. And there are different forms. Your child literally wears this underwear. And once that underwear sense, it has a sensor. Once it senses moisture, meaning that your child's about to start peeing, the alarm goes off. And there are different types. There's the one that buzzes and kind of vibrates. So the one that actually rings and wakes your child up. So your child then suddenly stops, gets up, and goes to use the bathroom. So this is something that you do need, some degree of buy, because some kids just sleep right through that alarm. So you really need to really make sure that you're really getting your child engaged. And I would say, in terms of getting your child engaged, something that you want to do is positive reinforcement. Again, remember that this is not voluntary, right? This is not something that your child, if they had control over, they would stop it. So avoid shaming them. I would recommend positive reinforcement, encourage them, help them not to feel that shame, right? This is not something that's uncommon, right? And so I think that is something that definitely helps. Now we're going to get into more like tactical stuff, right? Like a sleep disorder. If you're concerned, if you have a child who has had persistent bedwetting, you've done all these things, and they're having other symptoms, maybe they're having difficulties with sleep, they're snoring, they're waking up frequently, they're tired during the day, you absolutely need to have your child evaluated for a sleep disorder. Obstructive sleep apnea is associated with bedwetting. So we want to really address that, especially the secondary type, but sometimes the primary one as well. So that's something that you absolutely want to treat, you actually want to address. The other thing you want to make sure that they don't have is a structural abnormality. So we talked about abnormality of the urinary tract, right? So they may need to see a specialist like a urologist where they will do some scans. They might do some bladder scans. They might do some x-rays. They might do some imaging to figure out what's going on. And some of these actually need surgery, surgical repair. If they have constipation, you definitely want to move those bowels as well as possible. Make sure that they're taking foods containing fiber. They may need to be on medication. You may need to work on their diet because, again, constipation is a very common reason why children have bedwetting. And then in some situations, we actually do recommend using medication. So by the time that you're talking about them being on medication, of course, you're speaking to a specialist. And so there are two main common medicines you may have heard of. One is called desmopressin, and then the other one is oxybutynin. And they work differently, but the goal is to really help your child with concentrating the urine, with holding on so that they're not having accidents. And these tend to be very effective. So we've talked about a lot of things. We've talked about what bedwetting is, the types, the causes, the treatments, and you can see there's so many reasons. But if you're out there and your child is bedwetting, relax. This is something that is quite common. It is associated with some stigma, but I think just working collaboratively with your child's care team, so a physician, a sleep expert, a urologist, if they need to, will really help you get to the bottom of it. And I hope this has been helpful. Listen, if it has, I want you to do me a favor. I want to get the word out there. So share this episode with friends, with family, save it so you can come back to it. And if you are in a situation where you are concerned about your child's sleep issues, maybe they're bedwetting, maybe they have any other type of struggle sleeping, then give us a call at the Restful Sleep Place. This is where we provide services to children and adults with sleep issues. And we are located in California, in Pennsylvania, and New Jersey. We offer virtual options. We offer in-service, in-person options as well. And our phone number is 215-607-8297. And our website where you can follow us, learn about the work we do is therestfulsleepplace.com. Let me know how this resonates with you in the comments. Until next time, I hope you rest well.